Well, he quit eating well. He'd always been a really good eater, but then he was almost 3.5, and 3.5-year-olds don't always eat well. And then he had a couple of headaches. He had a few episodes of vomiting, but they also were very sporadic, and we couldn't see any other symptoms with those. And we took him to the pediatrician once the vomiting became a little more frequent, and he thought that Gavin had developed reflux. One morning he woke up and the fluid in his brain had built up to a level that he just couldn't find a comfortable place. And we decided to take him to the emergency room after he grabbed his head and just started shaking it violently. They did a CT scan pretty quickly after that, and we learned that he had a large brain tumor.
Children with brain tumors present a specific challenge, because not only are you dealing with the tumor and where it's located and what the implications of that are, but a lot of times the chemotherapy regimen and radiation are very intensive, and there really is no good way to prepare a family for what lies ahead.
Initially, he was placed in the ICU, and they let the fluid drain off of his brain for a few days, and then they went in and removed about 98% of the brain tumor. We waited 4 weeks for him to recover from that. We did 6 weeks of chemotherapy. We did 6 weeks of radiation with some chemotherapy at the same time, and then we did additional chemotherapy every 3 weeks for another 10 months or so. We've had a very positive experience with Children's Medical Center. The medical staff is very knowledgeable. They were very caring, they were very respectful. We always came in with a bunch of questions, and they took the time to answer all of our questions. They didn't just make the decisions and tell you this is what we're going to do. They made you a part of the treatment plan, and that was comforting to us to know that we were part of it all.
Gavin is doing absolutely amazing. There is no evidence that he has any residual tumor or any spread of tumor anywhere. He has completed his therapy. He is growing like a weed, and has just really come alive in the past several weeks.
He finished chemotherapy at the end of June, and he had a clear MRI in August, and he's due to have another one in just another week, which we plan for it to be clear as well. He is in physical, occupational, and speech therapy and progressing well with all 3 of those. He's working hard to get better, and he's in preschool 2 days a week and really enjoying just being with all the other kids. We've been really fortunate to have a top 10 pediatric cancer center here in our own backyard, where we can receive exceptional care for very aggressive cancer without having to travel across the country. I think it's important for people to give to hospitals like this. Children's is a non-for-profit organization, so they depend heavily on community donors.
Receiving donations from the community for our program has such far-reaching effects that I don't think that people realize just how much it means to families, to patients, and to us. I don't think there's anything that says more to a family that we know what you're going through, we care about what you're going through, and we're behind you 100%. From a physician standpoint, and for those of us at the Center for Cancer and Blood Disorders, it means that the community is behind us also. They're aware of what it is that we're trying to do, and donations from the community provide us with the resources we need to be able to treat patients to the best of our ability.
You can't imagine ever needing these services, but once you're here, you recognize and appreciate the importance of the donations that this facility receives. And if you were in these shoes, you would want the latest and greatest of technology and care for your child. And I can't emphasize the importance of people really supporting this as much as they possibly can.